probably already heard of this disease, hypertension, aka high blood pressure. But what do we really know about it? I'm Dr. Carolina Melgar from Sono Health, and today I would like to answer some questions about this topic that I get many times from my patients. For instance, did you know that 1 in 3 American adults have hypertension? And in most cases, it doesn't have any symptoms. So you might ask yourselves, how do I know that I have hypertension? So if you're an adult in the United States and you haven't had your blood pressure checked, there's a good chance you could have hypertension. If your blood pressure is extremely high, you may get symptoms of headaches or visual changes. But most people with hypertension don't get any symptoms. So despite this, hypertension can gradually damage your arteries and therefore your vital organs. This happens because the increased pressure can damage the blood vessels. So what happens if you have hypertension and you don't know it? Well, untreated high blood pressure can eventually lead to serious complications, including heart attack, stroke, heart failure, aneurysm, among many others. Fortunately, checking your blood pressure is not complicated, and it's also easy to implement lifestyle changes that can help reduce your blood pressure. The easiest way to tell if you have hypertension is to consistently measure your blood pressure. So another question I have from my patients is my blood pressure high? Now, it does seem like a simple question, but the answer depends on different factors. So, for a healthy adult, you want to be thinking of a target of less than 120/80. That's your normal blood pressure. Research shows that your ideal blood pressure is lower than 120/80, but it's not considered hypertension unless it's over 140/90. And it's also true that you might not need medical treatment if you only have this blood pressure once and it doesn't repeat itself. However, if you repeatedly have high blood pressure readings, it's very likely that your doctor might consider medical treatment. Another factor that we have to consider is if you have any other medical conditions that might be relevant. For example, if you have kidney disease or diabetes, it's very likely that you will receive medical treatment. So if you've not had your blood pressure checked recently, please go out and have it checked. It doesn't take long and it can make a big difference to your health. So if you enjoyed this video and you would like to learn more about hypertension, please follow me and check out my other videos related to this disease. I'll be answering the top questions that people have about their blood pressure. Thank you for watching.